This is a presentation for our module Sports Issues done by Keiran Davis, Ryan Stevens, Alec Jenkins and Cath. Introduction. As a group, we will be discussing the issues in two different scenarios in sport. Scenario 1, the travelling athlete. Scenario 2, the injured gymnast. The travelling athlete. Tom is an aspiring 150-metre athlete who is a 21-year-old and currently ranked in the top 5 in the world for his age. He has aspirations of competing in the 2012 Olympics and is very much focused on a 4-year macro cycle to achieve his goal. His coach has suggested that he starts to integrate altitude training into his schedule in effect to stimulate and increase his athletic capacity. Altitude training, traditionally referred to as altitude camp, is the practice by some endurance athletes of training for several weeks at high altitude, preferably over 2,500 metres or 8,000 foot above sea level. At intermediate altitudes, the air still contains approximately 20.9% oxygen, but the barometric pressure and thus the partial pressure of oxygen is reduced. The body may adapt to the relative lack of oxygen hypoxia in one or more ways, such as increasing the mass of red blood cells and haemoglobin, or altering muscle metabolism. Athletes travel to competitions at lower altitudes, they will still have the higher concentration of red blood cells for 10 to 14 days, and this gives them a competitive advantage. Facts. High altitude refers to heights that are between 1,500 and 3,500 metres above sea level. Very high altitude is from 3,500 to 5,500 above sea level. Extreme altitude is from 5,500 to 7,500 metres above sea level. From London to Colorado, it takes 6 hours on a flight. The time difference is 7 hours. London to Denver, Colorado is 3,567.6 miles apart. Here is also some background history on altitude training. The study of altitude training was heavily delved into during and after the 1968 Olympics, which took place in Mexico City. Mexico is 7,349 feet above sea level. It was during these Olympic Games that endurance events saw significant below-record finishes, and anaerobic sprint events broke all types of records. Benefits of altitude training. Training at high altitude gives runners a competitive edge over those who train at sea level when placed in direct competition. Whether the high altitude dweller goes down to sea level to compete in a race or his counterpart at sea level comes to a higher elevation to race, the runner who lives and trains at a higher elevation will likely have a distinct advantage. At high altitudes, there is a decrease in oxygen hemoglobin saturation. In order to compensate for this, erythropoietin, EPO, is a hormone secreted in the kidneys, stimulates red blood cells production from bone marrow in order to increase hemoglobin saturation and oxygen delivery. It is uncertain how long adaptations takes because various studies have found different constellations based on the amount of time spent at high altitudes. Within the group, we have come to conclude that Tom's coach has been very pushy in this process. For any athlete, with the distance travelled, the time it took and the time zone change would have a massive effect, let alone Tom's coach has given him no time to rest and adapt to the new time zone. He is straight into training, which has now led to overtraining. With Tom in this situation, the symptoms shown are that of altitude sickness. Causes of altitude sickness. Have had altitude sickness before, do strenuous activity or exercise at high altitude, rapidly ascend to high altitude, have a lung infection. Treatment of altitude sickness. Make sure you drink enough fluids and rest. Take painkillers such as paracetamol or ibuprofen if you have a headache. Take anaesthetic medicines such as cinnarizine or promethazine or other common antihistamines to ease sickness and dizziness. Scenario 2. The injured gymnast. Lauren is a 16-year-old elite gymnast who injured herself at the end of the last competitive season while performing a vault. Her hand slipped off the horse and she landed awkwardly on her neck, causing minor concussion and a temporary numbness in her body. It was diagnosed that she had sprained ligaments and muscles in the cervical region of her spine. She was instructed to take 4 months of gymnastics and report for the injury rehabilitation 3 times a week. She has been off school during this period, which has meant she has missed most of her early A-level coursework. After diligently following this precipitation for 2 months against original medical advice, Lauren and her coach decided it was time to return to full-time training. Following her return to full-time training, she is finding it difficult to catch up and maintain the required level of schoolwork. It became clear that she was very reluctant to attempt difficult vaulting moves. Lauren was finding it increasingly difficult to regain full fitness. She had become frustrated and unable to manage her fear of vaulting. Her coach, unaware of the potential risks and obsessed by the need to get Lauren back to competing, has become very aggressive and negative in her comments to Lauren. By definition, neck strain injuries do not involve serious injury to any of the vital structures and also are not associated with any fractures or dislocations of any of the bones in the cervical spine. To be consistent here, the term strain will be used. Both strains and sprains of the neck may involve tears to the ligaments, covering the cervical vertebrae, the many muscles of the neck, and many other associated structures. They may also result in injury to cervical nerves caused by stretching or compression. Because you can be injured in a number of different ways, a detailed medical and job history is often needed to ascertain the likelihood of a severe injury. It also helps to predict how long your recovery will take and what your prognosis will be following an injury. As with other conditions, supportive self-care is often enough for you to have complete recovery. Severity of the injury. Pulled muscle generally takes about 3 weeks to heal. A simple fracture can heal in 5 to 6 weeks. Ligament and tendon are made with thick fibrous tissue and do not have large blood supply. When injured, they heal more slowly than bones or muscles and may take 6 to 8 weeks to heal. Cartilage and discs can take longer time to heal, and repeated damage can further lengthen the healing time. Extensive damage may require surgery, however, a reasonable estimate would be 3 to 6 months. Conclusion. As the Regional Performance Director of Great British Gymnastics, I would explain the injury in detail to the coach. Explain the content of the injury, for example, duration of recovery. Tell Lauren to concentrate on her A levels due to the absence since the injury and training frequently. Warn the coach on what she has been doing is unacceptable to make her realise she is putting too much pressure on Lauren and the coach may not realise she's doing it. We have now come to the end of the presentation. I would like to thank you all for your time, and if you have any questions, please go ahead and ask.